Hey, fellow foodies. I'm so excited to have you here this week. We have a very special guest, Dr. Matt Bernstein. Matt, can you tell us what you're going to be sharing with us today?
Well, I'm a psychiatrist that practices metabolic psychiatry. So it's the art of using food and other things to improve metabolism to then improve brain and mental health.
We're talking food, we're talking mental health, lots to learn in this episode. Hello, fellow foodies, and welcome back. You're listening to Foodie Pharmacology, the science podcast for the food curious. We are here now in season 7 of the show. I'm so very excited to share some amazing episodes coming down the pipeline. And to kick the year off, we have a very special guest, Dr. Matt Bernstein. He is a psychiatrist who specializes in metabolic medicine. So, really looking at that intersection between our diet and our kind of gut brain axis. We're going to learn a little bit more about that in a moment. But to begin, let me tell you a bit about him. Matt has been a clinical psychiatrist for more than 20 years. He is Accord's chief executive officer and one of the leading voices in the emerging field of metabolic psychiatry. He graduated as summa cum laude from Columbia University in New York with a bachelor's degree in English literature and received his medical degree from the Perelman School of Medicine at University of Pennsylvania in Philadelphia. He later trained at the McLean Psychiatry Residency Program in Belmont, Massachusetts, where he also served as chief resident. And he remained at McLean after residency to work as a psychiatrist in charge and later served as the assistant medical director of its schizophrenia and bipolar inpatient program. Um, I'm just so excited to learn about what you're doing now, Matt, with metabolic medicine and its ties to psychiatry. So thanks for joining us on the show.
Thanks for having me.
Yeah. So why don't we start with just some basics? How did you get interested in this tie between metabolism and diet and mental health?
Well, there's sort of long and medium and short versions of the story. I'll maybe start with the short version and we'll see where we go from there.
Great.
I've always been open-minded about trying to do whatever I can to help my patients, and I've always recognized that the field of psychiatry does help a lot of people, but a lot of people get left behind. People with severe mental illness, severe depression, bipolar disorder, schizophrenia. With the best treatments we have, even, we can't help a lot of the folks. And so really trying to figure out what are the other things that can help has always been part of my MO. And probably about 7 years ago, I was at a lecture at McLean Hospital where Dr. Chris Palmer was speaking about ketogenic diets in severe mental illness.
Mhm.
And for people who don't know, ketogenic diets are high in fat, medium or moderate protein, and very low in carbohydrates, which induces our body to create these molecules called ketones. And it turns out that this is very, very good for the brain. And we've known this for actually over 100 years. They started giving ketogenic diets to kids with epilepsy at the Mayo Clinic in 1921. And there's now 13 randomized trials of ketogenic diets in pediatric and adult epilepsy, proving that it's very, very effective. And it's now, I learned about 7 years ago being applied in mental health. Chris Palmer is one of the, sort of on the vanguard of this, sort of a leading voice in this in the world. Um, and so I sort of learned about that and thought to myself, well, this is great, but isn't it going to be hard for my patients who are already struggling with lots of things in life to do this kind of diet? And so I tried it out on myself. I did a ketogenic diet for a few months and I felt amazing. But at the time, we had a lot of things going on in our family. Two of our kids had an illness that we were really struggling through, and I didn't have time to figure out how to apply this in my practice. Um, Fast forward to about 3 years ago, and things are getting better with my kids, and I'm thinking I really need to figure out how to do something with all of this knowledge. And I started, applying these metabolic approaches with my patients, sort of softly at first, but then realizing how powerful it was, now doing it, much more boldly with people. Yeah.
Amazing. So, as a physician and clinician, you're seeing, I'm assuming, a number of different types of psychiatric cases. Where have you found dietary changes to be the most influential? What types of patients have you looked at?
Well, the thing about it that's interesting is especially if we can get into a state of ketosis with diet, it's really powerful for almost every brain health condition that it's been studied for. We know that it's good in Alzheimer's, dementia. It seems to be helpful in autism. It's very good in these serious mental illnesses like bipolar disorder, major depression, schizophrenia, obsessive compulsive disorder, um, early recovery from substance abuse. It's now being studied in anorexia, and bulimia, binge eating disorder. I mean, it's it sounds like I'm selling snake oil because what could work on all these things, right? And it works in epilepsy as well. But the reality is that there's good reasons for that. That we're getting back to a more evolutionarily appropriate way of eating and for our metabolisms, and that we've all become metabolically sick by getting so far away from this more evolutionary way of eating and metabolizing food.
So when you're looking at the biomarkers of health for patients, are there certain types of indicators in the blood that show that there's been a shift following this ketogenic diet? I really don't know that much about it, so I'd love to learn more.
Yeah.
Like, how do you track change at a kind of at a biochemical level?
Yeah, excellent question. So at first, before someone starts, I'll get a set of lab work. And some of the things we're looking at really a lot of this has to do with blood glucose or blood sugar control. And the main marker that's most helpful in this is looking at actually a fasting insulin level. So insulin, for you and your listeners who may not know, is the hormone that allows us to turn food into usable nutrients in the cells, essentially brings the nutrients into the cells to be used to uh, provide fuel, to provide building blocks, all of those things. We need insulin. But over time, the way we've been eating, I was sort of referencing this before, lots of carbohydrates, eating 4, 5, 6 times a day, eating well into the night and first thing in the morning. Our insulin levels are too high all the time. We're supposed to have periods, we evolved having periods when we weren't eating all the time and we didn't have food and we weren't eating high carbohydrate meals a lot of the time as well, right? And so when the insulin's high all the time, we develop this thing called insulin resistance. Our cells are seeing this signal nonstop, and eventually they don't respond to the signal the same way they were before. And so what the body does is say, well, we need that signal to be received. So we're going to make more and more insulin. The pancreas makes more insulin to get that signal through. And it's a vicious cycle. The more insulin that's being made, the more resistant the cells are becoming. And eventually that leads to prediabetes and then diabetes. So we can see the root causes of those illnesses right off the bat by looking at a fasting insulin level. And if someone's fasting insulin is high, they're already on that road essentially towards that problem. But what we also know is that, different organs are insulin resistant in different ways. So the brain could be more insulin resistant than the rest of the body. And we know that a lot of the mental health conditions are associated with brain insulin resistance now. And so even when someone's not insulin resistant in their blood, this may be a useful intervention for other reasons, which we can get into. So those are some of the things I track at first. But then when someone's on a ketogenic diet, we can simply measure one of the ketones in their blood. There's a machine, you do a finger stick, and we can measure something called beta hydroxybutyrate right in their blood. And that'll tell us what level of ketosis they're in. And that's a great marker to be following when someone's doing this approach.
So, can you tell us a little bit more about what a day in the life of someone following a ketogenic diet might look like? Because you
Sure.
mentioned, low carbs, high fats, some protein, but like what does it actually look like in the reality of like the cycle of eating? Is it limited to certain times? Is there a fasting component to this?
Yeah.
How does it all work?
So there can be. I mean, a little bit of fasting sometimes can help jumpstart ketosis or deepen ketosis for people, and a lot of people really benefit from some fasting, but it's not necessary. In fact, interestingly enough, the roots of this diet go all the way back to the ancient Greeks with Hippocrates, and they would notice that when people were having seizures nonstop, they would fast them. And after about 2 or 3 days of fasting, very high levels of ketones are made, and the seizures would break and resolve. But of course, that's not a long term strategy. You can't fast all the time. And in 1921 at the Mayo Clinic, they were looking for a diet that mimics fasting, essentially. And there's very important reasons biochemically, medically, why when when you're eating a high fat diet, you're mimicking the fasting state. And mostly it's about getting the body to create ketones, essentially. So what it looks like is, eating a moderate amount of protein, 1.2 to 1.6 grams per kilogram per day. I usually recommend higher than what the USRDA says, but not super high protein because that'll actually inhibit ketosis. Really limiting all these carbohydrate foods. So, especially simple carbohydrates. So, no sugar, no processed
Liver
grains,
ultra processed foods kind of fall in that
no ultra
category,
processed
right?
foods.
Yeah.
Yeah. I mean, we like to do a whole foods version of this diet, which we
Mm.
known as the well-formulated ketogenic diet. So someone may have, some eggs and maybe some strawberries for breakfast. They may have a salad with protein and avocado and olive oil dressing for lunch, and then another protein with a vegetable for dinner with a sauce that has some more fat in it. Because we really need to get the ratio of fat to calories from fat higher than the amount of calories from protein from and carbohydrates combined, essentially.
So does this mean too, because in my mind, when you said a high fat diet, I'm thinking like pork
Yeah.
or, or beef stew with like fat flip. No, we're talking also plant fats can apply here. Yes.
Absolutely,
Okay.
yes. In fact, yeah, it does not have to be animal fat. There are people who do vegetarian ketogenic diets, and I even know someone who has long-term been doing a vegan ketogenic diet, although that's very hard to do.
Yeah.
Um, it's easier to do it with animal protein, I have to say, and I think I prefer when people are using animal protein for various reasons. But the fats don't have to be from animal sources. We
Okay.
can get, most of the fats from olive oil, avocados, avocado oil. We can,
How
get
about
fats.
cheese? Can cheese?
Cheese,
Okay.
absolutely, yeah, if someone
Yeah, great.
tolerates dairy, we can use
Uh-huh.
dairy fat, which, really helps, if make it a more, um, varied diet, if
Ah.
someone can eat dairy, that's really helpful.
So
Um,
it's not it doesn't sound like an impossible sort of diet to follow because I know some things can be hard to adapt to if you're making a radical shift in your diet. So I mean, it sounds like there are a lot of options that folks might already be eating,
yes,
just perhaps paired with more carbs, you just cut those carbs back.
exactly.
And so you're looking at baseline blood biomarkers for your patients. You're tracking this, I'm assuming, over time. What other
Yeah,
things do you track in a clinical trial or even in just general patient care? Are you looking at self-reported outcomes? Are you looking at, how do
yes.
you tell if this is really helping with mental health?
Yeah, great question. So at the program that I started called Accord, we are tracking a lot of things. So we're tracking ketones, we're tracking glucose on with a continuous glucose monitor. We are tracking body composition with a machine that measures body composition. So we're looking at things like visceral fat, percent body fat, muscle mass. We're trying to get an increase in muscle mass, a reduction in fat, especially visceral fat. But we're also doing all these rating scales. So multiple rating scales that people are getting each week, and then some of them are monthly. So we're seeing the correlations between the rating scale improvements and the metabolic improvements. And then we'll also get that full blood work once a month as well in that program. So
Amazing.
really looking at cholesterol levels and insulin, and there's micronutrient levels we're looking at, and levels of inflammation that change. All of that ends up becoming really, correlated with these mental health improvements, which is
Great.
amazing to see. Yeah.
Yeah, I'm gonna ask a crazy question, although maybe it's not so crazy anymore because so many patients are on these now, the GLP-1 inhibitors. Like,
Right.
so we're talking about Ozempic and Wegovy. Um, I'm just not very familiar with the mental health literature. Do you have patients that are on those types of pharmaceuticals in addition to trying the ketogenic diet, or is that recommended? Yeah. What can you share on that end?
So, it's a question that we really don't have a great answer to yet. There's some suggestions that mental health can improve on these GLP-1 agonists, and then there's also a signal that it can worsen mental health. And I just looked at a paper last night showing some really concerning data about worsening mental health outcomes on these medications for people in the obesity population. It wasn't looking at people with mental health, but just people starting these medications for obesity and developing mental health conditions over time. Wasn't a perfectly, done study. So, again, the story isn't fully out yet. But what I would say is that there are people who really wanna do these lifestyle changes. They wanna change their diet. They wanna have, metabolism be a centerpiece of their treatment, but they're really having a hard time with their cravings. They can't quite make that transition. And a couple of those folks I've had go to other doctors who prescribe those drugs, and that has allowed them to make these changes. And then I've seen their mental health completely turn around in a positive way, really blossom. So, I think they could play a role in that transition period. I don't love the idea of people being on those drugs in general long term, but if someone can use them as a transition to making the changes that improve their metabolism long term and then wean themselves off the medication or use a lower dose of the medication, sometimes I think we're using much higher doses than people need.
Yeah.
Um, so I think they can play a role, but there's some questions that still need to be answered. Yeah.
Yeah. No, that's such a great point. I mean, it's an evolving area of medicine for sure. And I mean, the reality is it can be difficult for people to make these changes because I almost feel like when you're trying to make a dietary change, especially away from ultra processed foods, it's almost like you have to go counterculture
Right.
because they just inundate our entire shopping experience. It's difficult to kind of change your own behaviors because you're so heavily targeted through marketing to,
Yes.
use
Yeah, you're
these
swimming
supplements.
against the tide, and then there's also a lot of social pressure with food.
Mhm.
People work in offices and, what do people bring to the office, gathering, donuts and cakes and it's sort of weird to say no to those things in those settings. People don't like when I say, "No,
Yeah.
thanks, I'm not gonna have that." I mean, people get it with me now because everyone knows me and, they
Mhm.
know my deal, but, at first, it's sort of like, "Well, what do you mean? Like, you're not having the sweets that everyone's having?" Like, it's sort of a version of peer pressure on some level. Yeah.
Yeah, and I'm thinking also with office gatherings, alcohol plays a role in a lot of the
Yes.
workspace kind of gatherings. Where does alcohol fit with the ketogenic diet?
It it's not good.
Okay.
Yeah, but in general, it's not good for mental health anyway.
In general, yeah.
Yeah. So, once people have a pretty serious mental health condition, I'm talking to them about really reducing alcohol consumption anyway, whether they're doing this metabolic approach or not. And, it's not that someone can never have an alcoholic beverage in a ketogenic diet. They may be able to have, a lower carbohydrate one, maybe a small, you know, portion of spirits, or a very low carbohydrate beer or something, or, one glass of wine. But once they're getting into multiple drinks, it's really going to interfere with the process of ketogenesis.
Yeah. And so with the ketogenic diet, is this something that you do for is it a long-term commitment or is this something that people do in cycles or does it really depend on the situation? Yeah.
Great question. So if someone's doing this just for general health, which I think there's a great argument to be made for that as well. Like I said, evolutionarily, we were definitely going in and out of ketosis during different points of the year, different, depending on what food was available and how well the hunt went and all of those things, right? Um, so for that, I don't think it's necessary that it has to be all the time ketosis. But if we're using it in this medical way for a serious brain health condition, the idea would be stay in ketosis. Don't go in and out of ketosis as much as you can. Um, and in the epilepsy literature and experience, it's very interesting. So a lot of the times it's applied to kids. They'll often have, many seizures a day. They'll end up on one or two or three anti-epileptic medications, and they're still having seizures. Often they get switched to a ketogenic diet and their seizures are in much better control, and they can come off of those medications and stay in good seizure control. And with kids with epilepsy, what they found is that after 2 or 3 years on the diet, they can really back off on the diet and the seizures remain gone. But those are kids with a much more plastic brain than adults. And so we don't know in adult mental health whether that's going to be possible or not. There are some, stories of some people who have done the ketogenic diet for a few years for their mental health condition and have been able to come off the diet and their mental health condition has not returned. But those are just a few, a couple of stories. So we just don't know if that's going to be possible for the majority of people.
Well, I also wonder, as we learn more about the gut microbiome as well, and we've had some different guests on the show, Dr. Renault Jones, who runs a notobiotic core at Emory to study kind of germ-free and then germ-defined mice
Yeah.
studies. We've had Vanessa Spiridiano, who's the chair of microbiology at University of Wisconsin-Madison, and she looks at um, microbes and their recognition of different neuroreceptors in the gut to kind of in line with this gut brain axis and also looking at cocaine addiction. And I wonder too, like, you know, it seems certainly possible that with a overall dietary shift that you're not just changing what your body's consuming, you're changing what the microbes in your body are consuming. And so I
Absolutely.
wonder if like creating this lasting microbiome shift might also be responsible in some way for some of these changes with communication with the gut brain axis. And I just don't know, is the science there yet that's really delved into that when it comes to mental health? I don't know the literature very well in this space.
Yep. Well, there's a lot of, literature on, gut brain axis and mental health, of course, but we don't have enough knowledge to really come up with interventions. What I would say is that it's one of the mechanisms by which people think the ketogenic diet helps with brain health is certainly a change in microbiome. That's well known from a ketogenic diet. But I don't think we're there yet science wise with how to measure that and how to know, like, do we have enough of a shift to, and then would it shift back if we change the diet back as well? So there's a lot of questions there, but we do know it's one of the mechanisms for sure.
Yeah. So I mean, it's fascinating. It just shows again why this kind of work on the science of diet and how it ties into various health outcomes is so important. We need to invest more in these areas of science, and in translational research in particular, for humans. Um, so let's get back to some of the types of patients that may benefit from the ketogenic diet. I know that previously you treated patients with bipolar disorder and also schizophrenics, and I know um, that there are sometimes issues with medication compliance in these patient populations. How compliant are they with a ketogenic diet? Do you see? Because I'm like,
Yeah.
if they're not going to take a medicine, are they going to stick with the diet? I mean, and
Yeah.
does their disease allow them to do that?
It's a great question. Yeah, it's hard. If someone doesn't have insight into having an illness, which can happen, especially with chronic psychotic disorders like schizophrenia, schizoaffective disorder, they're not going to want to do a whole bunch of things to, maybe, change their state. However, there are this subset of people who understand they've got an illness, but they really don't like the medications. You know, some of these medications that, I've been prescribing for more than 20 years that I know can sometimes be life-saving have just terrible side effect profiles in terms of causing metabolic disruption, neurological side effects, but also, especially the antipsychotics, induce this syndrome of avolition where people, we call it negative symptoms, and there are negative symptoms of something like schizophrenia, but the medications themselves induce a state that's very similar to that by blocking dopamine receptors. and blocking dopamine neurotransmission, which is really our neurotransmitter that's involved in motivation and why someone would care about doing something. And so when we block dopamine receptors, we lose that. People even lose a feeling of pleasure sometimes. And so people don't often like being on these medications. And some of them, they want treatment, but they want a different option. They want something that will help them, you know, be on a lower dose of the medication perhaps, or to lose, you know, 50 pounds that they gain by being on this medication. So, it depends on the person, but there are a lot of people who are really interested in this. And there's a huge groundswell. I mean, most of the people that come to our program are learning about our program directly, but not learning it from their doctor or from their therapist. They're learning about it because this is now something that people are writing books about, and there's a lot of talk on social media and the internet about this. Really being effective. There's a group called Metabolic Mind that posts videos about metabolic treatment for mental health, a couple of times a week, and so that's very popular. And other places as well that I could point people to. But there's lots of places to learn about this now. Yeah.
That's amazing. All right. I think that's so important to give patients additional options. Also, it gives them some control over their treatment as well, like that it's part
Right.
of their daily rhythm. I feel like, I mean, in my opinion, I like to see a true integration of medicines. Like, I think there's so much that we can learn from dietary traditions and also from the use of medicinal plants. But at the same time, I'm not one to turn down a pharmaceutical if it's necessary for a
Right.
condition. So I think all too often we kind of look at these in a very polarizing way. And I think the best form of medicine is when we can look at the pros and cons and really have
Yes.
an honest assessment of what's right for each person. And in some cases, maybe it's a bit of both, right?
That's exactly right. Yeah,
Yeah.
the goal is not that everyone needs to come off their psychiatric medication or
Yeah.
not ever need them. When that happens, that can be a wonderful thing if that's what someone's motivation is. But most of the people who are coming to me are saying, not that they wanna come off their medication, but they just wanna feel better.
Yeah.
They want their symptoms to be better, they want their side effects to be better, and this approach can do that along with medication. Again, sometimes being able to lower the dose of the medication or take people off of, sometimes people come on 5 or 6 medications, which is unfortunately very common in the world of psychiatry these days with these severe
Yeah.
conditions. Yeah.
Well, I know really it became it seemed like a very alarming rise in mental health disorders among adolescents and teens, especially after the pandemic. And
Yes.
I'm wondering how much is known about diet, the role of diet in teen mental health. Is there anything you can share about that? Like have these types of diets proven effective for teenagers as well?
So, without a doubt, yeah, some teenagers are doing these types of diets, and again, with kids, and maybe if someone doesn't have a real severe mental illness, it's
Mhm.
they're dealing with anxiety, let's say, or maybe the combination of some anxiety and some attentional issues that might be diagnosed as ADHD. They may not need to do the full version of a high ketogenic diet to get these benefits. Just eating a whole foods diet, lower in carbohydrates, adding in some exercise, and just improving that insulin resistance, improving that metabolism could have enormous benefits. Um, Now, I'm saying just, but even those changes are challenging in our culture, as we've talked about. But it doesn't need to necessarily be a full medical ketogenic diet to get some benefits, depending on the condition, depending on someone's age. Um, there's a study that I like to cite that was in JAMA Psychiatry, Journal of American Medical Association Psychiatry, so a prestigious journal in 2021, where they were looking at the metabolic health of kids and then mental health outcomes later on in life. So they followed people over a long period of time. They were measuring all these metabolic markers and mental health markers the whole time. And the kids at age 9 who had the highest insulin levels, that was something we were talking about before, sign of metabolic, ill health, compared to the lowest insulin levels, they had a 3 times greater chance of developing a psychotic disorder later on in their 20s. And then same study, they looked at the kids who gained the most weight in puberty, ended up with a 5 times greater risk of major depressive disorder later on in their 20s. So it really matters. And people just think, well, it's just food, this is what everyone's eating, but it's really important for brain health, overall health, of course, but brain health
Yeah.
especially is what I care about.
Well, I think it makes there's so many contributions also to health disparities because of the role of food and diet. If you look at,
Yeah.
a lot of the foods that are accessible to low income households tend to be those ultra processed foods, and you see a rise in obesity among children that are on those types of diets. And I think we need to pay more attention to this, as I'm
Yeah.
sure you agree. Yeah, these
Yeah.
changes are really needed, and they need to start in the schools because, on the other hand, it's the reality for many children in the country is that sometimes their school lunch is the only meal that they get, their only source of nourishment during the day, and if we're not feeding them appropriate whole foods, that really sets them on a bad trajectory.
Absolutely. Yeah. I mean, I'm involved in this organization called the Metabolic Revolution, and they just are they're distributing right now. I'm helping to distribute um, a petition to ban ultra processed foods from schools, and that would go a very long way to improving the health of our kids and our teens, for sure.
I'm sure there are many listeners that would love to sign on to that ban as
Yeah.
well
Yeah.
because it's such a huge problem. Well, I want to get back to the molecular role of the ketogenic diet as well in
Yeah.
health. And I know that there's a role that it plays also on mitochondrial
Right.
function. Can you tell us a bit more about, maybe start with the basics? What's the role of the mitochondria
Yeah.
in our cell and our metabolism? How does this diet affect their functionality?
Yeah, great thing to talk about. So, I would say, it may be the most important role of the ketogenic diet. It's up there for sure in terms of improving mitochondrial health. So it's really important to know about. So mitochondria are these little organelles that are in almost all of our cells. They've been around for billions of years in cells. So literally, billions of years ago, at some point, a eukaryotic cell was developed by a single cell organism engulfing a bacteria. So these are essentially ancient bacteria that live in our cells, and they have now this symbiotic relationship with our cells. They have these very important roles within cells. Um, the most important role, the thing that people may remember from their biology classes, is they're the most important producers of energy in our cells. There are energy factories. So they're taking glucose or fatty acids or ketones and burning them as fuel to create ATP, which powers everything in the cell. But they do a lot more than that. These mitochondria, and this is very well documented in Chris Palmer's book, but there's a huge literature on mitochondria that exists. They're involved in helping the release of neurotransmitters in the neurons. They're involved in the first step of creating a hormone in all cells that create hormones. They're involved in actually changing the expression of genes in the nucleus of the cell. So they're actually sending signals to the nucleus and saying which genes should be turned on and which turned off. So we're learning more and more. They seem to respond to stress, and they seem to respond to things like mindfulness exercises. So we can affect our mitochondria with food, but we can affect our mitochondria with exercise and mindfulness and in all these ways that ultimately benefit our mental health, our brain health. Um, and the ketogenic diet really strongly affects mitochondria. So ketones are a signal that cause what's called mitophagy. My, in our cells, we're constantly recycling organelles, we're constantly recycling cells, we're constantly recycling things and breaking them down into parts and creating new ones. A mitochondria, the lifespan of a mitochondria, I don't know, I can't remember off my top of my head, but it's not that long. It may be, a few days or a week, and then it gets broken down for parts and a new mitochondria is made. Um, and ketones are a signal to make that process happen more. So to break down these non-functioning or poorly functioning mitochondria, make new ones that are functioning optimally, and just generally making more of them, mitochondrial biogenesis. And we think this is probably one of the most important ways that ketogenic diets improve brain health is by doing that in the brain.
That's amazing. And thank you for describing it in such a clear way too.
Yeah. Yeah.
Yeah, it's interesting, as you're describing this, also, a lot of this kind of falls in line with a lot of traditional systems of medicine that
Yeah.
do involve mindfulness, that do involve, you know, appropriate diets, that do involve light exercise, moderate exercise. I mean,
Right.
I feel like these are all no brainers, but somehow we don't always follow the recipes for
Yeah.
health. And it's great to see how things are coming about in the scientific sphere to understand on a cellular level how these actions might actually help with our
Yes.
health.
Yeah,
Yeah.
and the one other part that I put in there always, like, you've named the 3 of the pillars, but the 4th pillar is circadian rhythm
Yes.
attunement, alignment, which is also part of our evolutionary history. We did not evolve indoors away from the sun, and the sun, natural light is the most important thing to get our internal biological clocks tuned up every day. We need to see sun in the morning. That's the most important signal to set our circadian clock. And we know that there's incredibly damaging health outcomes when their circadian rhythms are off. We know this from studying shift workers. People have to work night shifts and they have much higher rates of heart disease, cancer. They die at younger ages. The more years that someone does night shift work, the worse off they are in terms of their physical health and their mental health. And that has to do with light, being around bright blue lights throughout the night and not being aligned with the circadian rhythm of our planet and our sun. And so that's another thing that's very hard to do and going against the grain in our modern world. Um, we're indoor creatures, we're on screens, we have this blue light hitting us in the evening that disrupts the circadian rhythm and the melatonin production. So it's a hard one to do, but it's a really powerful one. If people can even just make some small steps, it can be really powerful.
Yeah, I'm thinking in particular of my teenagers and the late nights of them on video games and have to take away their remotes because
Yeah.
their sleep rhythms really get off cycle. And I mean, anecdotally, I can say that the times in my life when I feel my best is usually when I'm out in the field plant collecting, but that usually entails me getting up early with the sun, working there
Yes.
and really aligning myself with a circadian, clock of a, day work and night sleep, and
Yes.
getting enough sleep too, plus the physical activity.
Yeah.
Um, yeah, but
And
I
just
think
being in nature, can
yeah,
really
and being around and
improve
being in
our health.
nature as well, and
Yeah.
just exposure to
Yeah.
plants and all their wonderful components.
Absolutely. So
Yeah.
true. Yeah.
Well, I wanted to make sure we had some time to also talk a little bit more about Accord. Can you
Yes.
share with us kind of what is Accord all about? Like, yeah, kind of what does it offer to an audience?
Yeah. So, I mean, I've named some of the things about it already. So we have a little house. It's very homey. We recently renovated. It has this beautiful kitchen. That's sort of the centerpiece of the house. We have myself as the psychiatrist. We have a program director who's a wonderful social worker. We have a dietitian and we have a wonderful chef and a personal trainer to help people getting going with exercise. And so it's really an immersion in all the things that we've been talking about. So a well-formulated ketogenic diet that's, fit to someone's individual tastes, um, circadian rhythm alignment, some exercise, some mindfulness practices, and all this measurement that we're talking about is all going on while someone's there. And so it's for people who really want to use this approach, a metabolic approach to improve their physical health, mental health, brain health, all of that all at once. And it makes it easier because, as we're saying, some of this stuff is hard to do. There's a lot to learn. There's a lot of changes to make. So it's essentially getting immersed in it, which makes it a lot easier. Still not easy. I mean, people find it's still challenging, but it's easier when you're immersed and other people are helping you do it. And then we're also teaching people all the things they need to know so that they can do it when they get back home.
That's great. I mean, I think we could all use a little hand holding. Whether it's learning how to cook the right types of foods or
Yeah.
exercising this year. I finally invested in a gym membership that I actually attend because I have accountability with a trainer that like will
Right.
be waiting on me. And so
That's
I'm
great.
just the kind of person I need that accountability or I'll like, well, I'll just go tomorrow. And then tomorrow becomes next year that I haven't gone.
Yeah.
So yeah,
Most people benefit from accountability. Yeah.
yeah,
There are a few rare folks who just are self-starters and can do all of this on their own, but most people really benefit from support, from accountability, from a community of people who are doing this hard thing together. People really benefit. Yeah.
amazing. So, is there anything that we missed? I just want to make sure that we covered all the parts because this is such a fascinating topic around the ketogenic diet and mental health. I mean, you've covered a lot of the mechanisms, the clinical data, some of the basic facets that people can integrate into their own lives. Any other kind of nuggets to share with us?
Absolutely. Yeah. I mean, I was thinking with your interest in your audience, it might be helpful to think a little bit more about some of the food choices and components within a
Mhm.
ketogenic diet. And there's some controversy around these things, as I'm sure you're not surprised by. So, there's a community of people who really believe the most important aspect is animal protein and animal fat, and actually are wary of some of the compounds that are in plants that, um, things like, um, you know, polyphenols and oxalates and lectins and phytates, these things that plants make to protect themselves, which, you know, if you look at whole studies, really do have, you know, plants clearly have health benefits in the grand population. But there are individual people who find that when they eliminate plants from their diet, they feel better. It improves their gut health, it improves their autoimmune conditions, it improves their mental health. And so I think this is something that just it's important to think about. These things in plants, like especially polyphenols, we can talk about, these compounds that are in plants, I think are incredibly important. But
Yeah.
the
They
way
confer
they work,
antioxidant activity,
yeah,
anti-inflammatory activity.
yeah,
Lectins, I can see how lectins could be problematic, especially depending on the plant. These are like plant proteins that some people can
right,
have reactions to or have
right.
intolerances to. Um, yeah.
Yeah, so some people, are wary, and oxalates too. Oxalates,
Well,
very high
oxalates,
oxalate foods can cause kidney stones in certain
yes.
people who can't dispose of them. There are other people writing books about how, there may be a lot of other subtle health problems from oxalates. Um,
Like
so,
if they stay
this
away from like what is it, starfruit and dock
sorrel.
and sorrel. A lot of these wild veggies that I love to nibble on, they taste a bit like
Yeah,
little vinegary flavor because of the
right,
oxalates. But you're right, like high levels of oxalates are bad. They can
right,
damage kidneys, they can actually cause irritation in the mouth. They're
right,
really rich in a lot of our house plants. This is why you want to keep your pets and kids away from eating a lot of those low light growing house plants.
right,
It's the oxalates. Yeah.
right. But, I mean, I really do believe that even if someone may benefit short term from, reducing some of these exposures, they should try to come back to
Yeah.
the plant foods. And polyphenols are, there's incredible data for those. And some of the molecular mechanisms that they find, of the way polyphenols actually help cells, there's a lot of overlap with the way ketones actually help cells,
Nice.
from a gene and molecular point of view. So that's really just fascinating. I always find. So I always say that, even if your ketones aren't quite as high, if you're eating this really varied diet with lots of different
Mhm.
polyphenols, like that can make up for potentially in certain people a lower level of ketones and still getting some of the
Yeah.
same benefits. Yeah.
I mean, the more I learn about the ways that we prepare foods and how that influences bioavailability of some of these potent anti-inflammatory molecules in plants. I'm thinking in particular, I've got two examples. One would be lycopene, which is an
Mhm.
important antioxidant found in tomatoes. It's the red in a
Yeah.
tomato. But
Right.
we actually it's a fat soluble antioxidant. So if you combine it, cook it with a fat, and also interestingly, an allium like garlic or onion, you have higher absorption rates of that antioxidant. And the
Right.
same for turmeric. You don't really get the curcumin without additional fats and piperine from black pepper. So these,
Right.
I'm working on my next book, and the working title of one of the chapters is "The Secrets in the Curry," because it really is like
Yes.
combining these, certain types of fats with these herbs in these combinations can lead to overall better health outcomes.
Right. Yeah,
Yeah.
I mean, these are things that people have learned over generations and generations.
Yeah,
There's wisdom there that we have to pay attention to and validate scientifically, but
absolutely.
we find when we're doing the science that, oh, well, this is based on, ancient wisdom. Um, and just, you're talking about antioxidants, the the ketogenic diet is very much an antioxidant diet,
Mhm.
even if you don't eat a lot of these other antioxidant compounds, because burning of fat for fuel causes much less oxidative stress than burning glucose all the time for fuel. So
Yeah.
there's a huge antioxidant benefit just from the macronutrient itself. But of course, we also benefit from, antioxidants in foods. And I think, you know, we don't know yet, but I personally think that a lot of that has to do with our microbiome, our
Mhm.
microbiota, you know, benefiting from these polyphenolic compounds and doing different things with them than even we could do in our own cells. And there's just so much that's going to be discovered about this, hopefully over the next, decades. It's
Oh,
fascinating. Yeah.
absolutely. I'm so excited about the data coming out around the gut microbiome. There was one guest we had a few years ago, Bruce German, who ran this incredible study looking at the composition of human breast milk
Mm,
and discovered that there are certain sugars found in breast milk that the infant can't digest themselves, but instead was basically food for a certain member of the microbiome that
yeah.
is important to infant development and health. So, I mean,
Yeah.
even our own bodies are creating, foods that are targeting specific members of the microbiome. And so yeah, it's just there's just so much to explore here. This is like the new space age for me. I mean, it's like
Yes.
diving within the gut is where we're gonna find
Yes.
some interesting things, I think, in the future.
Yeah, that I agree. That is an incredible thing. These human milk oligosaccharides, I think it's called,
Yeah,
that and they only come online right before the baby is about to start solid food or get off of breast milk. So they increase like at around month 5 or
yeah,
6, and they're not even, somehow evolutionarily we figured out that, we don't need to make those, or, women's breasts don't need to make those
yeah.
until that time when they're about to switch over to solid food. So it's an incredible
Well,
thing.
like, who would have thought it? I mean, that's what makes science so amazing. We can,
Yeah.
like, take these deep dives. Wow. Well, thank you so much for coming on the show, Matt. Can you share with us where can folks go to learn more about your work and about Accord? Do you have a website you can share with us?
Yes. So the Accord website is accordmh.com. So it stands for Accord Mental Health, Accord
Okay,
MH. And then people can find me on LinkedIn if they want. I don't have a big social media presence, but I do
mm,
have a LinkedIn account. And
great.
if someone wanted to contact me directly there, I'd be happy to interact there. Yeah.
Fantastic. Well, thanks so much. I learned a lot. I'm really curious to see, how ketogenic is my diet already because we are big like whole food eaters at home. I may already be kind of eating it, although, well, I'm trying to be good during dry January, but I do include alcohol. It's my science. I have to cut back on that some to get more compliant with the ketogenic diet. And my husband's Italian, so we do eat a lot of pasta. But other than that, we're eating lots of veggies.
Yeah.
And meat.
Pasta will definitely knock you out of
Yeah.
ketosis for sure. Um,
Yeah.
but I can totally understand Italian pasta can be delicious.
It can
Yeah.
be very delicious. Yeah. Awesome. Well, thanks so much for joining us. And thank you to our listeners for tuning in today. I also want to shout out of thanks to our producers, to Rob Cohen and Christine Roth, for putting on the show for you. Again, we are in season 7. You can catch all of our past seasons as well on our website at foodiepharmacology.com. You can also head over to our YouTube channel, Teach Ethnobotany, to find this and our other video versions of the podcast. Of course, you can always find us on any of your favorite podcast streaming services. And we really appreciate any comments or feedback you can offer on the show. Leave those 5-star reviews on Apple. That always helps us to get the word out. We are now being listened to, by the way, by over 138 countries, which I think is super exciting. And to all of those out there around the world, thanks for listening. We're so excited to have you here, and we're looking forward to a fresh new season. So thanks so much for listening. Stay healthy out there, and I'll see you next time.